imagine this, if you operate them well, they do very, very well. You have a child that is basically almost normal, or normal I would say. They can grow up, they become active, their feeding is much better, they can grow, they can go to school, university, get married and have children. So essentially it's a correctable congenital heart disease, and you can offer them the world after they recover. My name is Dr. Siti Laura Mazalan. I'm a consultant Paediatric Cardiothoracic Surgeon here in Pantai Hospital Kuala Lumpur. We always have the aim to provide the best surgical procedure and the latest one that we can provide with good surgery outcome and good post-operative care. Because the aim is always to make sure the child go back home living a normal life, going to school, having friends, being able to go back and involve in activities, going out with their friends and playing. So our aim is always to provide the best of care so that this patient can lead as normal life as possible. My subspecialization require me to do not just the bread and butter, which is the hole in the heart and a child having cyanotic heart disease, but also a subspecialization such as slide tracheoplasty, which is a multidisciplinary surgery for which we do it together concurrently with a cardiac procedure. Another subspecialization that I do is called ECMO. It's an extracorporeal membrane oxygenation support, whereby when the heart and lung is actually failing after a cardiac procedure or related to a certain disease, we actually connect the heart and the lung to an artificial heart and lung, which is a bit more mobile, what we call the ECMO support. Another subspecialization of mine is called a cardiac homograph tissue banking. As you know that they are heart donors, instead of transplanting the whole heart into the donor in the recipient heart, what we do is that we take individual aortic or pulmonary homograph, we process it and preserve it in a cryopreservation freezer. When a child doesn't have a proper aortic or a pulmonary valve, we can take this human donated valve and implant it into the recipient. Another part that is of my, I would say, passionate about is actually the single ventricle program. Which means is that the child is not amenable for a complete surgery. This patient will undergo single ventricle surgery like Glenn Shunt and Fontan. Whereby in Malaysia, we only started the single ventricle for I think less than 10 or 15 years ago in comparison to abroad. Previously, all these patients would have gone to overseas for a single ventricle surgery. Now, for the past 10 and plus years, we're able to do it in Malaysia. Another procedure that I would say that I'm extremely proud about would be the door-to-door neonatal surgery. Children with complete heart block, noticed by the obstetrician when they do a scan on the baby in the mother's womb, would have a heart block. Heart block means that their heart rate is very, very low. So what we can offer is that when upon delivery, we transfer the patient to the cardiac OR and implant the pacemaker device. So this would really save the patient's life. So like they lahir, what we do is that we bring the patient, deliver via C-section, we transfer the patient to the adjacent OR, we intubate the patient, put all the lines in, open the sternum, actually put in the pacemaker for the patient. So the pacemaker is implanted within the first hours of life. This was when I was doing my postgraduate study. During the time, he had a hole in the heart and also a defect valve, I would say. So he underwent closure hole in the heart and subsequently had the valve replaced. and he did very, very well. The child grew up being very healthy and actually ended up entering the same medical school as I did. So having said that, that was an eye-opener, because if you can do a really good surgery for the child, you are giving them a lifelong of health and also the ability for them to conquer the world, I would say. I hope for the future is for the people to be aware that congenital cardiac diseases, whether in children or in adults, we can offer them treatment, whether in form of surgery or transcatheter or hybrid procedure, whether it's simple, intermediate or complex that require multidisciplinary approach. Parents should not be waiting to get their procedure being done at a later period. Nowadays, we can do and offer the procedure to be done as early as possible. In Pantai Hospital Kuala Lumpur, not only that we are able to provide a comprehensive facility, but we also are very experienced in this field. We could provide a multidisciplinary care for a patient that require a complex congenital cardiac procedure. Not only a simple and straightforward ones, but our team has got the range of subspecialty that is able to provide the best of care.